السلام عليكم. هاي محاضرة موجهة إلى طلبة الصف الثالث بكلية طب الكندي، جزء من منهاج مادة الرينال موديول. الموضوع هو Anatomy of the urinary bladder and the prostate. قدمها دكتور حارث محمد قنبر. بالجزء الأول قدمنا Anatomy of the urinary bladder، هسه راح نبدي نحكي عن Anatomy of the prostate. Talking about the prostate. The prostate is a fibromuscular glandular organ that surrounds the prostatic urethra. It is about 3 cm long and lies between the neck of the bladder above, the neck of the bladder, and the urogenital diaphragm below. اللي هو هذا urogenital diaphragm. The prostate is surrounded by fibrous capsule مثل ما تشوفوها هنا. The prostate is somewhat conical in shape. It has base that lies against the bladder neck and has apex which lies against the urogenital diaphragm. هذه الأبيكس مالتها وهذه البيز مال البروستات. The two ejaculatory ducts pierces the prostate pierce the upper part of the posterior surface of the prostate to open in the prostatic urethra at the lateral margin of the prostatic atricle. وراح نحكي شنو البروستاتيك اتريكل من راح نحكي عن البروستاتيك urethra. Relations مال البروستات. The base of the prostate, this part of the prostate, is continuous with the neck of the bladder. The smooth muscle passing without interruption from an organ to other. يعني من البلادر للبروستات the smooth muscle fiber will pass without interruption. The urethra enters the center of the base of the prostate. هذه البيز the center it enters the urethra enters the base of the prostate. Inferiorly, the apex of the prostate lies against the urogenital diaphragm. The urethra leaves the apex of the prostate or leaves the prostate just anterior to the apex. يعني بدل ما تطلع اليوريثرا قبل من الابيكس لا راح يصير بها كينكينج وتطلع just anterior to the apex. Anteriorly, the prostate is related to the symphysis pubis. Separated from the symphysis, symphysis pubis, the prostate is separated from it by the fat and by the dorsal venous complex or Santorini plexus and loosely attached adipose tissue in the retropubic space. يعني بين البروستات والسيمفيسيس بيوبس او البيوبيك بون اكو الكيف اوف ريتياس اللي موجود ب loose areolar fatty tissue and the dorsal venous plexus or Santorini plexus. بالمناسبة اسمها dorsal نسبة إلى لأنه تستقبل الدورزال vein of the penis، فيسموها dorsal نسبة إلى الدورزال vein إلى of the penis، وإلا هي بالنسبة للبروستات تعتبر anterior للبروستات. The prostate is connected to the posterior aspect of the pubic bones by the facial puboprostatic ligament. Posteriorly, the prostate is closely related to the anterior surface of the rectum, separated from it by the rectovesical septum or the denonvillar fascia. This one. This rectovesical pouch, this septum is formed in fetal life by the fusion of the walls of the lower end of the rectovesical pouch of the peritoneum, which originally extended down to the perineal body. Posterolaterally, a neurovascular bundle that gives supply to the prostate and corpora cavernosa of the penis are embedded in the endopelvic fascia on both sides. النيوروفاسكولار bundle تصير تقريبا بهالمكان وبهالمكان. اكو عندنا صورة توضحها. Anteriorly عندنا Santorini plexus, which receives the dorsal vein of the penis. This is the neurovascular bundle. It's posterolaterally, and this is the denonvillar fascia separating the posterior surface of the prostate from the rectum. Laterally, the prostate is embraced by the anterior fibers of the levator ani muscle as they run posteriorly from the pubic bone. The structure of the prostate. The prostate contains numerous glands embedded in a mixture of smooth muscle and connective tissue, and the ducts of the glands open in the prostatic urethra. Regarding the structure of the prostate, هذا اللي نشوف هذا الجلاندولار tissue. هذا الاليفيشن اسمه الفيرومونتانم. هسه راح نحكي عنه باليوريثرا. This is the prostatic atricle, and these are the opening of the ejaculatory duct, and these are the opening of the prostatic glands. The prostate, regarding the anatomy of the prostate is considered, it was classified or described by two anatomists. One of them is Losley, who considered that the prostate is divided into 5 lobes. He describes the prostate as it have an anterior lobe, lies in front of the urethra and devoid of glandular tissue, and the median or middle lobe, which when it grows, it can indent the base or the trigone of the bladder, forming the uvula vesicae. It is a wedge of the gland situated between the urethra and the ejaculatory duct. Its upper surface related to the triangle and of the bladder. It is rich in glands. This is the median or middle lobe. The posterior lobe, this one, that lies situated behind the urethra and below the ejaculatory duct, also contains glandular tissue, in addition to left and right lateral lobes on both sides of the prostate, and are separated from one another by a shallow vertical groove on the posterior surface of the prostate. The lateral lobes contain many glands. Another anatomist, McNeil, considered that the prostate divided into 4 zones. He describes the prostate according to functional and developmental basis. He describes it in 4 zones. The first zone is the transition zone that surrounds the urethra proximal to the ejaculatory duct. It contains about 5% of the glandular tissue. The second zone is the central zone, which surrounds the ejaculatory ducts and projects under the bladder base. It contains about 25% of the glandular tissue. The peripheral zone surrounds both of these lobes and forms the bulk of the prostate and the apical part of the prostate. It forms the apical, the posterior, and the lateral aspects of the prostate. And finally, there is an anterior fibromuscular stroma. It is a non-glandular tissue. The majority of glandular tissue is in the peripheral zone. The anterior fibromuscular stroma is non-glandular tissue. It extends from the bladder neck to the striated urethral sphincter. Regarding the function of the prostate produces a thin milky fluid, contains citric acid and acid phosphatase that is added to the seminal fluid at the time of ejaculation. The smooth muscle which surrounds the gland squeezes the secretion into the prostatic urethra. The prostatic secretions are alkaline and help neutralize the acidity of the vagina. Blood supply of the prostate. The prostate is supplied by the inferior vesicle and the middle rectal arteries, by branches of the inferior vesicle and middle rectal arteries, and the venous drainage of the prostate goes to the prostatic venous plexus, which lies outside the capsule of the prostate. The prostatic plexus receives the dorsal vein of the penis and numerous vesical veins, and it drains into the internal iliac veins. It has a communication with the vertebral venous plexus, and this is important because metastases from the prostate may go to the vertebrae through these communication. They are eventually a valveless communications. يعني ممكن يكون بهن back flow of venous fluid من ال prostatic venous plexus to the vertebral venous plexus. The lymphatic drainage of the prostate goes to the internal iliac lymph nodes. The prostate is supplied by the inferior hypogastric plexus. It has a sympathetic nerves that stimulates the smooth muscles of the prostate during ejaculation to prevent passage of the ejaculum or the ejaculated fluid to the bladder. They squeeze it forward through the urethra. This is the last to be discussed. The pre-prostatic and prostatic urethra will be discussed with the urethra. شكرا لاستماعكم. انتهت محاضرة البلادر and the prostate. شكرا جزيلا للجميع.